Hi, my name is Mohammed. I'm one of the pharmacists that works in the pain team, and today I'm going to talk to you about an important topic around sleep and medication. Now, as we know, sleep is one of the most commonly reported side effects of medication and also illicit drugs. And so it's very important that if you do have any of these side effects, then you discuss them with a healthcare professional so that we can look into this in more detail with you. Now, excessive sleepiness can be caused by the sedating effects of prescription-based medication, but also non-prescription medication, which we often buy in over-the-counter remedies. And sleep is a complex biological process, and so sometimes it's difficult to say exactly what's causing the effect on the sleep, whether that's part of the diet or a habit of the person or indeed a medication. Now, we know from science that some of the chemicals are involved in regulating sleep patterns, such as dopamine, adrenaline, noradrenaline, serotonin, histamine, glutamate, and acetylcholine. These are just some of the names of neurotransmitters that we know can regulate sleep and also alertness. Now, if you experience excessive sleepiness, especially during the daytime, then obviously this can be quite problematic. It can often lead to falls, it can lead to difficulty settling into jobs, and it can also cause breathing problems as well for people. Often patients who have pain, obviously this affects their quality of sleep, and so the day after they often struggle because as a result of having poor sleep. Now, in terms of medications, there are some common medications that we buy over the counter that can affect our sleep, but also regular medication which we might be taking for another condition. So these include things like beta blockers that we take for high blood pressure or for managing anxiety. There are common medications that we use for coughs and colds that we again buy over the counter, sometimes get them on prescription as well. So these contain decongestants or sympathomimetics, and these can often cause problems with sleep as well. Other medications include things like antihistamines, which we often take for hay fever and allergies. Other long-term medications for other conditions include things like antidepressants, steroids, diuretics for heart failure or conditions like that, or for managing blood pressure. And one of the common ones that we often see are things like anticonvulsant medications, so things that traditionally were used for epilepsy, but we now use them for pain, so things such as gabapentin and pregabalin. Additional to this, the big category is the class of drugs that we call opioids or opioid-like medications. So these include over-the-counter remedies such as codeine-based products, but also prescription-only medications and controlled drugs such as tramadol, morphine, oxycodone, all the way through to buprenorphine and even fentanyl. Now, these often make patients drowsy, especially in the initial phases of using them, but when your body becomes more tolerant to them and you take them for a longer period of time, then often they can cause hormonal changes and chemical changes in the body, which can then affect our quality of sleep. And so often patients report that after long-term use of opioids, they get nightmares, or they get disturbed sleep, or and often they fall asleep during the day but then struggle to sleep at night. Another type of medication that often affects sleep are the antidepressants or medications that we take for anxiety. And so one of the common ones that often gets mentioned is a drug called Amitriptyline. Now, this is a drug that belongs to the class of drugs called tricyclic antidepressants. Now, sometimes for patients who have pain, we have a bit of a dilemma, and that is that they have pain which is uncontrolled throughout the day, and often that can have an impact on the sleep at night. And so they also have fatigue because either because of the pain and that just feels like it's draining them all the time, but also because they can't get comfortable at night when they're trying to sleep. And so these patients then wake up in the morning and find that they've even despite sometimes sleeping for many hours or being in the bed for many hours, they've not actually had a good quality sleep, and so it's these kinds of patients that we often use drugs like amitriptyline for. Now, certain doses are what would normally be used for its antidepressant activity, but in a pain setting, we often use slightly different doses, and so our hope would be, or the aim would be, that by using a medication like amitriptyline, we can have like a double-pronged approach. So we would hope that it would, one, help with your sleep, but also help with your pain throughout the day as well. Now, the aim would never be to just give you a medication that's going to make you sleepy, but the whole purpose of using something like amitriptyline is that we know the important link that sleep has with chronic pain conditions, and so often they go hand in hand, and if you try and treat them both or help them both, then often that can have better results for patients. And so patients often complain that they either find it really difficult to get comfortable to get to sleep, or they can get to sleep pretty quickly, but they can't maintain their sleep, so they, after 1 or 2 hours, they'll wake up and then they'll be awake for a while before they finally nod off again. And so this cycle will continue, and throughout the night they often will wake up several times, and before you know it, it's the morning. And so medications like amitriptyline are things that we sometimes use to help initiate sleep and to help patients sleep for longer throughout the night without being interrupted in their sleep. But this is one aspect, or the one medication that we, sometimes use, and it's not for everyone, unfortunately. Now, sometimes the problems or the potential side effects outweigh that, and so patients, on the other hand, often wake up in the morning and then feel really drowsy sometimes. And many of you watching this video might have experienced this yourself, so it might help you with your sleep initially, but when you wake up in the morning, you've got like a hangover type effect. And so this is really important because it can obviously affect your ability to operate machinery. So driving, for example, if you have to drive to work first thing early in the morning, that can be really difficult. If you have to look after young kids, for example, or if you have a job that requires your full attention early in the morning, or you have to go really like an early morning shift, then obviously these medications might not be appropriate. So we can often try and mitigate this by reducing the dose or adjusting it slightly, adjusting the timing of the medication. So we often say medications like amitriptyline should be taken at least 2 to 3 hours before bed. So the time that you would normally get into bed, let's say around 10 o'clock, 10 p.m. in the evening, then we would say taking something like amitriptyline at around 7 o'clock, 7, 8 o'clock in the evening would be a good idea. So hopefully that shouldn't make you drowsy straight away. And so by the time you get to bedtime normally, then the medication should have started working by then. And so hopefully that will put you in a good routine for your sleep. Now, if you suspect that you are taking a medication that could potentially be disrupting your sleep, then often it's obviously a good idea to speak with your healthcare professional, and first and foremost, probably to your GP, as they would have an overview of all your medication that you're taking. Now, they can often change the medication to a different version, or that can still help your condition. So there might be other medication in that class that are less likely to cause that side effect. Often it could be that the medication is no longer needed, and so sometimes things like diet changes or lifestyle changes, exercise, etc., might be able to manage your condition, whatever that may be. And often it can mean that you can come off the medication that you've been on for a long time that might be affecting your sleep. The other important point that I wanted to highlight is often these days patients will use medications that are herbal remedies or products that they buy from herbal or health shops, or even online they purchase them, and often we don't know enough about these medications and what long-term effects they can have on sleep, just because there isn't enough data to suggest otherwise. And so we often recommend to patients that things like lavender and chamomile, these kinds of products are often put into tea and served as tea bags, and so people often take these, especially at night, and they find that it can help relax them and give them a better quality sleep. I would just say that on this point, I once had a patient that was waking up in the middle of the night, and when they couldn't sleep, they were taking a tea-based product like this. Now, it contained chamomile or lavender or something, but when we looked at the breakdown of the product, we found that it actually had caffeine inside as well. And so it's really important that if we're taking these products, that we take them with the advice of a healthcare professional, and we check them properly, and that we also check that they're not interacting with any of our regular medication that we take as well. Now, the final point I'll probably make is that any changes that you think might need to be made to your medication, then it's really important that you discuss this with either your pharmacist or a practice nurse or your GP, and they can guide you and look at all your medication, and you can come up with a plan together. Taking matters into your own hands and deciding which medication is good for your sleep and which medication isn't good for your sleep is probably not a good idea. And so on that note, I'd like to also include about medications that patients often use for which have an illicit and a drug abuse potential. So things like cannabis, amphetamines, marijuana, all these kinds of drugs, even caffeine obviously is included in there, nicotine and cocaine, all these kinds of medications that patients often abuse and people abuse on the street. They can sometimes have two effects, and so initially some of these drugs such as cannabis and marijuana, they can make patients feel a bit sleepy and a bit drowsy, whereas on the other hand, the things like the stimulant drugs like amphetamines and cocaine, etc., these medications might make you feel alert, especially initially, but if you take these drugs for a sustained period of time, then obviously it's only natural that if you're staying awake for so many hours, at some point when you stop taking that drug, then you're going to have a crash, and so you effectively stay at a peak like this, and then you all of a sudden dip really, really sharply, and so you then in that period or in that phase, sleep comes on really strongly. And so yes, these drugs might be stimulants, but they can also have an impact on your sleep in a long-term sense. So it's very important that people who are using these kinds of medications, and often patients who have pain, use cannabis-based products as well. So it's very important that you check this with your healthcare professional and discuss this with them on whether it's safe for you to continue taking these or not. So on that note, I'd like to conclude, and I hope you enjoyed this video, and hopefully the rest of our team will be putting together some further resources for you around sleep and medication, and also will provide you with some further references that you can read and that you can look into. And of course, as usual, if you have any further things that you want to discuss with us, then please do not hesitate to get in contact with us. Thank you.